Thank you so much for meeting with me today, Mr. Chao. It's a real pleasure to speak with you, especially in this time of crisis. Taiwan has been doing such an amazing and remarkable job at controlling the coronavirus spread in Taiwan. So, what is Taiwan doing that is flattening the curve so effectively?
Well, if you look at the situation in Taiwan, it's quite different from other places in the world. So we've taken action very early in the process, and prior to even a first case arriving in Taiwan in January, we were already screening all flights from Wuhan. We implemented a tracking and monitoring program. We stockpiled critical medical supplies and activated our central epidemic task force. So because of this, we actually did not have much of a curve. So we have sort of a different equation. So, there's still a lot of inherent risk. So it's important for us to not take this situation for granted. It's important to be vigilant and to continue treating things like we're still on the front lines, which we are. So what we're doing right now is we're refining some of the measures that we've taken over the past few months. For example, we're on our third iteration of a rationing system to ensure that everybody has an adequate supply of surgical masks. While schools and businesses are open, like you pointed out, we do have strict social distancing measures in place. We're improving tracking and monitoring tools as well so that nothing slips through the cracks. So certainly what we're really engaged in right now is to guard against COVID-19 coming into what is right now a relatively well-prepared society. And we want to prevent another spike, another jump in cases.
I'm curious. So, Taiwan has recent experience with other epidemics, especially the SARS outbreak from 2002 to 2004. Did Taiwan carry lessons forward from that experience that have helped today?
After SARS, we established new regulations that gave our health officials greater authority in a health crisis like this. We learned a lesson of preparing early and preparing constantly, and that's exactly what we've done this time around. So one other lesson we learned was to be hypersensitive to reports of mysterious illnesses and always err on the side of caution. The third lesson that we learned is just how fast viruses transcend national borders. I mean, SARS also came from China, and it led to us quarantining over 100,000 people. So we had to act very quickly to introduce travel restrictions and quarantine procedures. The fourth lesson was that all of this requires more than a healthcare response. It's really a whole of government effort. So there was really a coordinated effort from day one to ensure that we had good, fast, cross-governmental and across-the-board communication.
How can the United States and Taiwan cooperate to slow the spread of COVID-19 and hopefully recover from it soon?
First point, we're engaged in best practice sharing amongst senior government officials, medical professionals, and other stakeholders. Second point is we're ensuring that we have a robust supply of medical equipment. So aside from a large number of our companies that are already working together right now on the development of tests, vaccines, and other critical medicines, we are also coordinated on issues of raw materials, which are just as important. We've also announced the donation of 3.5 million surgical face masks to the United States to ensure that the frontline medical workers have the equipment they need. Taiwan and the United States are working together to provide essential aid to countries around the world, particularly actually in the Pacific. So getting back on our feet after COVID-19 will require economic activity to resume. It will require global commerce to resume and people-to-people exchanges and so forth. It is important for us to begin discussions on this issue so that we can start sharing what we've learned at a slightly more advanced phase right now of the coronavirus in Taiwan and what we're doing to make sure that COVID-19 cases don't pop out of nowhere and force society start having to reassess whether opening up is the right decision to make. And I think likewise we have a lot to learn from the U.S. as well, because there are a lot of states in the U.S. that also have begun discussions on this issue. Second point, we need to pay a lot of attention, I think, going forward in the international supply chains, particularly the sanctity of medical supply chains. So we saw a lot. This was a major, I think, both political and economic issue this time around when we saw, a lot of these medical equipment wasn't going to the places they need to be. And so given the closeness of our two economies, I think it's a discussion worth having, a discussion between Taiwan and the United States, close, like-minded partners on how we can ensure the sanctity of supply chains and also deepen our current, our current relationships between our businesses. The third point, I think we also need to take a deep look at the role international institutions played in this current pandemic and whether there were mechanisms or processes in place that can be improved for the future. So these are some of the discussions we see a lot of potential for further down the road when we do start, turning back this tide against COVID-19.